Adrienne joins me here live on the studio line. She's a physician assistant at Balanced Physician Care. Balanced Physician Care, a new way, well, not really new, but for many of you, it would be a new way to have a great doctor-patient relationship. I'm a patient at Balanced Physician Care and get to work with Adrienne and Dr. Cheryl Trudy and the whole team there. And it's a very good way to experience primary health care where you have people that respond to you immediately, very easy to communicate and connect with a doctor when you're not feeling well or when you have an issue. It's a pretty exciting approach, and more people are learning about it. Right, Adrienne?
Yep, that's true. So, like you said, direct primary healthcare, it's basically a model where think of it as subscription-based healthcare. So we're kind of taking out the middleman, which in this case is the insurance companies, and we're restoring medicine back to what it should be, which is, the relationship between the patient and the doctor or, PA, nurse practitioner that they want to be able to see.
Yeah. Yeah. For example, you wake up one morning, you feel like you have a sinus infection or you're just feeling really badly. A lot of us will struggle with, I don't want to go to some, care spot location or try to get an appointment with somebody that could take days. In the Balanced Physician Care model, you just email them. Typically, there'll be a video chat set up almost immediately, and, the drugs that you might need to feel better will be prescribed almost immediately, right?
Yeah. So the nice thing about our practice is because we're not dealing with insurance, we can provide greater accessibility of care. And, we also pride ourselves on being able to provide better quality of care because we're not so focused on quantity like you would be dealing with in a traditional primary care practice.
Yeah. The way the system works, by the way, is you basically pay a membership fee. For many of you, it will be about the same as what you might pay to go to a nice gym, for example. And that fee allows you to have this kind of level of service, but it's not exorbitant, but it gives you amazing health care. They can also help you with holistic approaches to medicine, too, including acupuncture. They can help you with lab issues, vaccinations. All that can be done. All the things that you would get at a traditional family care internist office, but I would argue a whole lot more, right?
Definitely. So, because a lot of our patients don't have insurance, what we've done is we've negotiated prices for more affordable labs. So some people find that even though they have insurance, they're going to pay less if they go through our practice to get labs done versus billing their insurance. And then, like you said, that flat monthly fee, it covers, all of your primary care visits with us. It's going to cover, some of the basic in-office procedures that we may do. For example, if you needed your ears cleaned out, rather than sending you to the ENT where you're probably going to be paying a couple $100s for the visit and the ear cleaning, we can do that for free as part of your monthly membership fee that you're paying.
Yeah, absolutely. I had that same experience, had, a variety of ear infections or whatever during that season a few months back, and Adrienne helped me a lot. I was able to see her and get some relief and get treatment immediately. Call the ENT office, and it was going to be, seriously, I'm not exaggerating, 4.5 months before I could get in to see them. And, of course, by that point, although I took the 4.5-month appointment, by the way, by the time we got there, I was fine. So, and I ended up canceling the appointment. But so it's about access to care, and we hear that from our listeners increasingly, especially in the last year, about family care physicians, family physician offices, your local doctor, if you will, how it's really, really hard to get an appointment, that they're booking 3-6 months out. Well, when you have flu-like symptoms, or you think you may have COVID, or you think you have a, some sort of, chest congestion, that's aggravating. Balanced Physician Care is there for you immediately. Okay. And I can attest to that. I've been a part of the practice for years now and highly recommend them. They're right here in our part of Northeast Florida. You can connect with them pretty easily at balancedphysiciancare.com. That's balancedphysiciancare.com. You can also find them easily on Facebook, and Dr. Trudy posts a lot of videos so you can get a really good sense of her approach to medicine, and she does embrace holistic approaches as well. She also has a ton of experience helping with sports medicine issues, including things you may have done out on the golf course or maybe something your grandchild did out on the baseball field. She can help with all that, and Adrienne can help with that as well, and, of course, acupuncture and other aspects of medicine. So we encourage you to learn more by going to balancedphysiciancare.com. We're going to play a song or two, and we'll come back with Adrienne, so stay tuned.